Good morning, sir. I have seen your one-man show videos in YouTube. I could not believe myself such things can happen in this world. You have saved so many young lives and saved many families from the clutches of lifelong suffering. God bless you, sir. Can you please tell me about what actually is heroic surgeries and one-man show? What inspired you to do such heroic surgeries?
Thank you very much. Good morning to each and everyone. It is a very good question. One man show actually means where one person does almost all the work, makes all the decisions, or runs entire show and action alone. The cases I am describing are all my real life challenges in most unfavorable and hostile situations. Each and every patient I operated was judged judiciously and analyzed meticulously in a shortest period without wasting time. That is why the surgical outcome was fantastic. The heroic surgery is totally different from elective and emergency surgery. It is like thunderbolt. You get a sudden call from one remote unknown hospital or nursing home about the patient. He is in critical condition, he is in coma, your mind is not prepared. You are preoccupied with some other thing. Or most of the time, it is midnight, especially on Sundays. You have only two options. Either you go and attend the patient or you will reject the call. Practically, either way is difficult because if you reject the call, you will feel guilty of not attending the serious patient and you don't know exactly who is the patient. On the other hand, if you decide to attend the patient, you have prepared yourself for the hostile environment. Believe me, most of the time, I have always attended the patient irrespective of my personal preoccupation and my interest. The heroic surgery terminology is not used in our textbook, nor it is discussed in our surgical forum like conferences. According to me, it is not a concept. This is a courageous act depending on the self-confidence, knowledge, and determination to save the patient at any cost. Here you do surgery in totally different environment. Everything depends solely on your action. You have to plan a strategy immediately and implement it immediately. You cannot wait. Otherwise, patient will not be there. It is a total sacrifice your personal interest. You put yourself in risky situation. For everything, you are the only one responsible. That is why no one dare to do this type of surgery. Fear and personal safety overtake heroism.
Thank you, doctor, for enlightening me. You are just great. I am feeling thrilled that we have very good doctors like you in our society. Can you please explain the next heroic case? Thank you.
Thank you very much. The present case is one more heroic case. Heroic because on that day it was Sunday midnight. I was going out around 10 o'clock by taking my car with my child, and I thought I will roam and come after some time. During that period, I received a call from one unknown nursing home from a lady doctor. She told one unconscious comatose patient has been brought traffic accident and kindly come and see the patient as no doctor is available for the patient to see. So I was in dilemma now because the hospital nursing home is around 20 kilometers far away from the place where I received the call. So at last, after receiving the call, I decided to go and attend the call. I straight away drove to the hospital nursing home. After reaching there, there were many people were waiting outside the nursing home in absolute silence. I straight went into the ICU and I called the doctor and she showed me. Patient was on ventilator. He was the only patient and there was a injury over the side of the head and the patient was totally immobile. There was no movement of limbs to deep pain. His pupils were fully dilated and not reacting to the light. Patient BP was 120 by 80, and at this stage, then luckily they have already done CT scan. It showed a massive clot over the left side of the brain, and it was pressing the brain and pushing it to the opposite side, causing the midline shift. What we call that means one side of the brain is pushed to the opposite side. I immediately told the doctor duty and the lady doctor who was in charge of the hospital. See, he requires an urgent surgery and that lady doctor was telling me, you please operate in our hospital only. Then I thought, I have come all the way. My small son is sitting in the car, and I was in dilemma. However, I told her to show me her OT. When I saw the operation theater, it was terrible. There is no proper light, also, there is no cautery. The anesthesia machine was an ancient type and absolutely horrible. And the doctor was insisting me to operate him there. I told, sorry, madam, I cannot operate in this. It is a very risky situation. He will collapse and die on the table. You don't take that risk. I will suggest you to immediately send him to government or municipality hospital. But what is the problem? The problem is his pupil is already dilated. On the way only he will collapse. So on reaching there, he will collapse. So you have one option only. Any nearby big hospital is there. You can take him there. However, all the private hospitals will demand money before entering only. If you want to get admitted, you have to deposit the money. And patients' relatives were all having no money. And what will you do? What I told, I will talk to the relatives. His wife was standing there along with many gentlemen. I called them and explained this is what the situation. Now he required an emergency surgery. You have got minimum option and least time because he is already on the deathbed. Once the pupil dilated means there is no much time. Even if you operate in such patient, you will not get result. That is why at the earliest time you have to operate. So I was aware of this. Few hospitals I was going. One hospital where I could get this case operated without any money deposit. That means you can get operated those days without paying the money at the beginning. So I told, if you are interested, you shift there earliest. I will leave my son and come there immediately. So they agreed, and immediately patient was put on ambulance. Luckily, it was there, and I took my son to home and drove back to the hospital. So meanwhile, they reached. On the way, I called the ICU emergency operation theater and I told them to arrange immediately everything. Arrange operation theater, call the anesthetist and all the admission process without taking any advance money. Directly take him to ICU, shave the head and keep. Meanwhile, I drove there and reached the hospital around 1 o'clock. I straight away talked to the anesthetist, explained to her, and took the patient to the operation theater. Within shortest period, I operated and removed the clot from the left side of the brain. It was a massive injury. The big clot was removed and his bone was not replaced because the brain was swelling dark red and black clots. So You know, it is a very dangerous look. But what to do? The operation has been done, the pressure has been removed. We do not know how much damage it has happened in the center of the brain, where actual our consciousness and important functions of the body is controlled. So we have to just keep him on ventilator and support his heart and blood pressure, all these things. After completing the surgery, controlling the bleeding, everything. Bone was not replaced and closed the skin, and patient was shifted back to the ICU. There he was kept with medication to prevent any, loss of falling in BP, all these things. So for like that, he was continued for 3 days. There was no movement, no change. Pupil was dilated and only. So everybody thought he is gone case. I also was having that opinion only, but the way operation was done, it was exemplary. So slowly on fourth day, the pupil started coming down. Pupil started coming down, but no movement. For 7 days, absolutely there was no movement. And after 7 days, we cannot keep the breathing tube into the mouth. We have to make a hole. So I was in a deep dilemma. Already unconscious patient. Patient is having limited budget. What do I to do? Opening in the windpipe, that is tracheostomy. So I was, just postponing. On the 10th day, he was started moving little limb. And believe me, he recovered slowly. And on third week, he became conscious, started obeying commands.
कितना दिन इसको
A
वेंटिलेटर पर रखा
patient
था?
whose pupil dilated for almost 2.5 hours and almost on the death trap was become conscious on third week of post-operative. Means after 15 days onwards, he showed consciousness. Then
कितना दिन इसको वेंटिलेटर पर रखा था? How many days totally? 18 days. Huh? 18. So after that one, no, it is ventilator में 16 days. Two days and he improved totally. Today he is happy. Huh? ಗೋಪಾಲ್ ನಾಲ್ಗೆ ತೋರಿಸು. ಕೈ ಎತ್ತು. ಕೈ ಮೇಲೆ ಎತ್ತು. ಎತ್ತು ಮೇಲೆ. ಮೇಲೆ ಎತ್ತು ಹೀಗೆ. ऊपर करो. ಮೇಲೆ ಮಾಡಿ. ऊपर करो. ಹಾಂ ಕರೋ. ನಮಸ್ಕಾರ ಮಾಡ್ತೀರಾ?
from that time onwards, he regained consciousness. He was shifted to from the ICU to the ward and for rehabilitation. Now, what has happened? See, this decision, no one can take because this was my personal decision. I was attached to that hospital. Normally, no surgeon will take such type of risk because you don't know. You don't know the background of the people, whether they are going to pay or not. This hospital is a major hospital and he is in coma, whether he is going to survive or not. Who will pay? Every day you have to pay shell out 40 to 60,000 depending upon the hospital where you go. Who will take such responsibility? The operation cost, the medicine cost, the hospital ICU stay cost, everything. So no one is ready to take all these things. And it is correct also. How can you take an unknown patient? You are doing charity like this. So these are all risky. Sometimes people are also become violent. And that is the one hospital which I was knowing I could manipulate and get operated. My intention was operate and remove the clot. Then next day you send the patient wherever they are interested. My whole interest, because I have seen him in the midnight, and it has happened just 1.5, 2 hours prior. He was traveling from shop to his residence, and there was a oil on the road. The two-wheeler, his son was a small boy, was sitting, I think 5 years old. Son was sitting behind, and the bike skidded and fell down, and he became instantly unconscious. And luckily there was some electricity bill in his purse, and the people traced his home address and called his wife. That is how the relatives could reach there. However, because it was Sunday midnight, no one was carrying money, and all these things of getting to a nearest nursing home. Suppose you see, I attended and guided them like this. Otherwise, it is impossible for shifting from that hospital. It requires a proactive effort on the part of surgeon to take such a responsibility. That is why this is an heroic action. And because of this action, probably nature gave me this exemplar result. Today, if you see, other than Scar is totally conscious, independent. For so many years, he is working and looking after. His family was having small kids. Today, they have grown up, and he once in a while, every year, once in a while, he come to my clinic to attend and tell me thank you, and you could appreciate this action. I am sure this type of action rarely, I have not heard, but you can see whenever you get that opportunity, you can also do this type of action. Thank you very much.
एक्सीडेंट हुआ था, हॉस्पिटल को लाया था ना वो कोपर कैरिने में।
हाँ
सो उस समय आप थे क्या?
हाँ थे।
मैं जब देखने को आया था,
हाँ हाँ थे।
सो आप कुछ याद है तो मेरे को बोलिए, उस समय क्या हुआ था इनको? हॉस्पिटल में लाया था नहीं?
जा रहे थे,
हाँ,
वाशी उनका बहन के घर पे जा रहे थे,
ओके
जाके आ रहे थे,
ओके,
तो लड़का भी था साथ में।
हाँ
आने के टाइम उनका वो बोल रहे गाड़ी स्लिप होके एक्सीडेंट हो गया।
ओके।
हाँ
फिर
फिर बाद में जब घर पे एक गाड़ी लेके एक आदमी आया, उनका गाड़ी में वो लाइट बिल का एड्रेस था,
हाँ
वो एड्रेस पे घर पे आए हुए।
हाँ हाँ।
फिर वो आके
फिर जब मैं देखने को आया था नहीं,
हाँ जब भी बेहोश थे वो,
हाँ, सो
बाद में आप बोले कि उधर लेके जाना पड़ेगा गोदरेज हॉस्पिटल।
क्यों मैंने बोला आपको? हॉस्पिटल में सुविधा नहीं था।
नहीं सुविधा कुछ भी नहीं था।
हाँ, सिर्फ
तो फिर एम्बुलेंस आपने सब फटाफट ये किया,
हाँ
और एम्बुलेंस करके सब एडमिट वगैरह सब आपने करके उसी दिन नाइट में 3 बजे ऑपरेशन सब करके 6 बजे तक का ऑपरेशन हुआ।
ओके।
फिर 16-17 दिन तक कोमा में ही थे।
हाँ, अभी कैसे है ये बोलो? ये कितना महीने में काम को ज्वाइन किया इन्होंने?
और 6 महीना तो अब तक घर पे ही थे।
6 महीना।
हाँ
उसके बाद वॉकिंग सब किया इन्होंने?
हाँ।
फिर
स्टार्टिंग में ऑफिस जाते
जब ऑपरेशन को बोला है ना, ये एक्सीडेंट हुआ था, आपका क्या मन में क्या विचार आया था इनको देख के? बेहोश था ना वो?
हाँ मन में तो बहुत सारा विचार आया था,
हाँ
लेकिन आप भगवान, पता नहीं आप मेरे लिए तो भगवान ही है आप।
हाँ। आपको कैसा लगा वो जो वो हॉस्पिटल में है? मैंने बोला इधर कुछ सुविधा नहीं है, सो इधर ऑपरेशन कर ही नहीं सकता है, आप तुरंत लेके जाओ इनको, ऐसा बोला था मैंने,
हाँ अच्छा लगा था आप बोले जब भी।
है ना? वो चीज़ अभी सोचेगा तो आपको मन में क्या लगता है?
डर डर लगता है।
हाँ हाँ
वो टाइम किसी को नहीं आए।
हाँ।
अभी आप ही मेरे लिए भगवान है, हमारे लिए।
नहीं, आपको वो उस दिन संडे था, संडे 11 बजे 12 बजे के बीच में मैं आया था उधर।
हाँ हाँ
करेक्ट। सो
हाँ,
उस
बराबर।
समय रातों रात है ना, किसी
हाँ, रात
किसी
रात
किसी बड़े लोगों को भी ऐसा सुविधा नहीं मिलता है।
नहीं मिलता, नहीं मिलता।
है ना?
नहीं
इतना
नहीं, हाँ
इतना
बराबर।
फास्ट, बिना
सब
पैसा
बात
बिना
बात।
डिपॉजिट, ताबड़
हाँ
तोड़।
हाँ
हाँ, आपको याद है?
हाँ, जल्दी।
पैसे
हाँ,
भरने का
सब
नहीं।
जल्दी जल्दी में एम्बुलेंस वगैरह की।
हाँ, और बिना डिपॉजिट इनका ऑपरेशन कराया था, याद है आपको? पैसा बाद में भरा था।
हाँ हाँ,
रात
बराबर।
रातों रात, है
हाँ
ना?
हाँ, पर हाँ, रात को पैसा नहीं था हाथ में, कुछ भी नहीं था।
हाँ, करेक्ट।
दूसरे 2 दिन के बाद दिए।
हाँ। सो ऐसा ऑपरेशन किधर भी नहीं होता है। करेक्ट।
नहीं होते, नहीं नहीं।
सो आप खुशी है, हमको हम भी खुश है।
अभी खुश हूँ, बहुत खुश है। बच्चों के लिए, मतलब मेरे बच्चे बहुत छोटे थे जब।
कितना उम्र था वो उनका, बच्चे का?
एक एक मतलब बड़ा वाला लड़का 10 साल का था, 9 साल का था। और लड़की 6-7 साल की थी।
ओ। और आपका घर में अर्निंग मेंबर कौन था?
कोई नहीं था।
वही था।
हाँ, वही थे। वेलकम
हाँ, गोपाल
वेलकम।
की तरह दिखाइए।
यहाँ
हाँ, बोलो गोपाल। कैसा है आप, काम को सब जाता है अभी?
अभी जाते हैं।
नॉर्मल।
रिटायर होने के बाद
रिटायर होने का, रिटायर होने भी जान लो।
हाँ, उस समय से अभी
रिटायर हो
तक
गए, फिर भी जा रहे हैं।
नहीं, उस समय से अभी तक काम कर रहा है।
हाँ,
हाँ,
कर रहे।
किधर हुआ था, चोट लगा था आपको, दिखाओ। ओ।
ये भी थोड़ा
हाँ
लगे हुए हैं।
यही जब बोले।
हाँ हाँ। अभी उधर कुछ
तो
तकलीफ
इसे
नहीं है?
नहीं नहीं, कभी 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 पीछे पीछे ऐसे ऐसा होता है।
हाँ। आपको कैसा
तकलीफ
लगा?
नहीं, अच्छा लगा।
हम भी। गोपाल, आपको देख के बहुत खुशी हो गया मेरे को। सो आपका नाम क्या है?
मेरा नाम गणेश है।
आप गोपाल का कैसा रिश्तेदार है?
मैं इनका छोटा भाई।
ओके। जब इनको एक्सीडेंट हुआ था ना,
जी जी हाँ।
कैसे हुआ था, आप बोलिए, बोल सकता है?
बोल सकते हैं ना।
हाँ, बोलिए ना।
क्योंकि ये ऑफिस से काम, मार्केट से आ रहे थे
हाँ।
शाम के समय। आते समय एक रोड में थोड़ा ऑयल गिरा हुआ था।
ओके।
तो स्कीट होके वो जरा गिर गए।
हाँ।
गिर गए तो वहीं पर उनका बेहोश हो गए।
ओके।
तो अनकॉन्शियस था। तो
ओके।
हम लोग तो नहीं थे वहाँ पर उस
हाँ।
समय। तो लेकिन वहाँ से हम लोग कोई तो दूसरा, उनके जेब में चिट्ठी था, तो उन्होंने हॉस्पिटल में उनको जो नज़दीक है हॉस्पिटल में एडमिट कर दिया।
हाँ।
तो एडमिट करने के बाद हमको इन्फॉर्म किया। तो इन्फॉर्म करने के बाद हम लोग आए, तो डॉक्टर से मिले। तो डॉक्टर बोले ये जरा अनकॉन्शियस है, ये होने वाला नहीं है यहाँ पर इतना बड़ा ऑपरेशन, तो आप कोई बड़ा हॉस्पिटल में लेके जाओ।
फिर ये गिरने के बाद तुरंत बेहोश हो गया?
बेहोश हो गए थे, बेहोश हो गए थे।
ओके। आपको गोपाल को एक्सीडेंट के बारे में कुछ मालूम नहीं है?
कुछ भी मालूम।
ठीक है। आपको कौन सा हॉस्पिटल में लेके गया?
फिर हम लोग सोचे कि पास में तो खाली बड़ा हॉस्पिटल ले गया तो बड़ा अमाउंट लग गया, तो हमने गोदे हॉस्पिटल में लेके गए।
ठीक है।
गोदे हॉस्पिटल में लेके गया तो
हाँ, वो अभी आपने वो नर्सिंग होम से उधर लेके गया है ना?
जी हाँ।
सो उधर आपने पैसा भरा था क्या?
नर्सिंग होम में हमने कुछ पैसा नहीं भरा हुआ था।
और उधर
उधर भी बड़ा हॉस्पिटल हम लोग गए तो वहाँ भी तो क्या है क्या, इनको ट्रीटमेंट जल्दी जाना था, तो वहाँ पर
पैसा
भी
नहीं था आपके
पैसा
पास?
मेरे पास बिल्कुल नहीं था।
डॉक्टर शणै ने क्या बोला?
तो वहाँ पर डॉक्टर शेना इमीडिएटली बोला कि इमीडिएटली ऑपरेशन करना पड़ेगा। तो उन्होंने बोला कि कोई बात नहीं, पैसा आप कल परसों देख लेगा क्या बोलते, तो आप इमीडिएट से ऑपरेशन करा लो।
वेरी
इसलिए
गुड।
हमने इमीडिएटली ऑपरेशन उनके कहने से, उनके डॉक्टर शेना के कहने से इमरजेंसी ऑपरेशन करवाए।
ठीक है।
तो उनका क्रिटिकल इतना कंडीशन खराब था, अगर 2-3 घंटे में अगर हम कुछ भी नहीं लेते तो कुछ भी हो सकता था।
वेरी गुड।
इसके लिए फिर हम लोग को डॉक्टर शेना की वजह से हम लोग को जरा ये अच्छा मिला।
अभी कैसा है, अभी गोपाल कैसा है?
अभी तो आप फर्स्ट क्लास टका है, इसके लिए मैं डॉक्टर शेना का शुक्रिया करना चाहता हूँ कि सच से बोल रहा हूँ।
सो आपको काम करने को सब होता है
होता
गोपाल?
है,
हाँ,
होता है, होता है।
आप हाँ, आप परफेक्टली नॉर्मल है। आपको क्या लगता है डॉक्टर शेनाई को देख के?
भगवान सही बात है,
हाँ।
मानना ही पड़ेगा क्योंकि
क्योंकि-
विदाउट पैसे हमारे पास, विदाउट पैसे उन्होंने हमारा मदद किया, इसके लिए थैंक्स बोलना चाहता हूँ।
क्योंकि वो संडे का रात में था।
रात को था,
1
करीबन
बजे।
रात को कुछ
1 बजे को।
हाँ, एक सवा 1 बजे का करीब था।
करेक्ट।
तो इमरजेंसी ऑपरेशन करा, उसी वजह से आज मेरा ये भाई ठीक ठाक है।
आपने जिस नर्सिंग होम में आप एडमिटेड था,
हाँ,
उधर ही क्यों ऑपरेशन नहीं किया?
क्योंकि वो हॉस्पिटल इतना छोटा था कि जितना इनका जो कंडीशन ऐसा खराब था कि वहाँ पर ऑपरेशन करने का कोई इतना
सुविधा
सहूलत नहीं था।
हाँ।
इसीलिए हम लोग को गोदे इतना बड़ा हॉस्पिटल लेके जाना पड़ा, डॉक्टर शिनाई की मदद से हमको वहाँ पर लेकर जाना पड़ा।
मगर रातों रात है ना आपको
तो क्या अब ये दूसरा को ही ना, वहाँ पर फैसिलिटी नहीं है।
हाँ।
जो अगर कुछ भी हो गया तो इमरजेंसी के लिए कोई फैसिलिटी नहीं, इसीलिए हम लोग को बड़ा हॉस्पिटल देखना पड़ा और पास में हमको दिखा गोदे हॉस्पिटल, इसके लिए हम वहीं पर ले गए क्योंकि वहाँ पर एकदम बेस्ट था इसके लिए।
When in today's world, if any patient brought as unknown to any hospital, without money or insurance, people will not even bother to see patient, leave alone admitting and operating. How you took such a brave decision in that hostile situation.
You are absolutely correct. Every service is chargeable in this world. But when you have to select life and death situation, and your inner feeling tells you that you can save this person, then I don't think any other thing other than saving him at any cost. The whole purpose I chose to become a neurosurgeon is to save young life from death trap. Even if I have saved one life, it will be a great thing in life, and I enjoy it. And I am grateful to Lord Almighty for giving me this opportunity to serve people. Thank you very much.